and in today's discussion we shall examine the symptoms of kidney failure, the indications of chronic kidney disease. You may be surprised to learn how many individuals you know are living with kidney disease, including notable figures such as Selena Gomez, Nick Cannon, Tracy Morgan, and George Lopez. And in fact, over 37 million Americans are currently affected by kidney disease, and many are unaware of their condition. Would you not wish to recognize the symptoms of kidney failure should you experience them? Today's focus is on the common symptoms associated with kidney failure. I am Dr. Freda, a medical professional holding triple board certification, specializing in nephrology at Emory University Hospital Midtown. Additionally, I serve as the medical director of a dialysis unit in Atlanta. In my role as a nephrologist, I routinely diagnose and manage cases of kidney failure. Frequently, I discover that patients are wholly unaware either of their risk factors or the symptoms indicative of kidney failure. The two leading causes of kidney failure in the United States are firstly diabetes and secondly hypertension. Those suffering from lupus also face an elevated risk. I encourage you to educate yourself further on diabetes and lupus, ideally after viewing this discussion. For many of my patients, better awareness of kidney failure symptoms and risk factors could have enabled them to prevent the onset of the condition. Therefore, today I shall elucidate 10 key symptoms of kidney failure. Let us consider how many individuals have been diagnosed with kidney disease only to be taken aback due to an absence of symptoms and a lack of knowledge of their risk factors. Please share your experiences below. 1. Fatigue. One symptom of kidney failure is persistent fatigue or excessive tiredness despite adequate sleep. Fatigue may result from anemia, a low blood count, or it may occur in the presence of shortness of breath, especially if there is fluid accumulation in the lungs associated with kidney failure. Thus, fatigue is a principal symptom. 2. Insomnia. Another potential indication is insomnia or difficulty with sleep. This can develop as a consequence of chemical or electrolyte imbalances that are associated with renal failure. If you struggle to obtain sufficient rest, insomnia may be indicative of underlying kidney issues. 3. Itching skin. Certain electrolytes, such as phosphorus, are usually filtered by healthy kidneys. When phosphorus levels become elevated, often during the more advanced stages of kidney disease, this can result in itching of the skin. Therefore, persistent itching may be a symptom. 4. Increased urination. If you notice that you are urinating increasingly frequently, especially if you are required to wake during the night to use the lavatory, this may signal kidney failure. Impaired kidney function decreases the concentration's ability of the urine, resulting in more frequent urination. However, frequent urination can also arise from other causes, such as diabetes, prostate enlargement, or urinary tract infections. If you experience this symptom, consult your healthcare provider. 5. Bubbly or foamy urine. The presence of noticeably bubbly or foamy urine, resembling the appearance of a freshly poured beer, can also be a sign. This occurs due to the leakage of proteins into the urine, an abnormal occurrence signifying renal impairment. Therefore, observe the appearance of your urine, and if it appears excessively foamy, seek medical advice. 6. Swelling of the legs or ankles, patients with kidney failure may experience swelling in the legs and ankles. This swelling can result from difficulties in sodium filtration or from fluid retention due to the compromised kidneys. There are, of course, various other causes of leg swelling, such as circulatory issues, heart failure, or blood clots. But if you notice unexplained swelling, it warrants medical evaluation. Have you experienced leg or ankle swelling and received a diagnosis for it? Please share your story below. Was it linked to kidney failure, heart failure, a clot, or another circulatory concern? 7. Reduced appetite, particularly in the later stages of kidney failure. One may experience a loss of appetite. Elevated toxins that are otherwise filtered out by healthy kidneys can cause an unpleasant taste, reducing the desire to eat and potentially leading to weight loss. Unintentional weight loss or diminished appetite warrants attention. 8. Nausea and vomiting. While these are non-specific symptoms with various causes, kidney failure remains one important possible reason. If you experience unexplained nausea or vomiting, it is imperative to consult your physician. 9. Unpleasant taste or breath. Advanced kidney failure may cause a metallic taste in the mouth, rendering food unpalatable. One may also observe a metallic odor or ammonia-like smell on the breath. These changes in taste or smell should prompt assessment for underlying renal dysfunction. 10. Tremors. The accumulation of toxins in the body due to kidney failure can be neurotoxic, resulting in tremors or shaking. Further, such toxins may cause unsteady gait or even recurrent falls, thus new onset tremors should not be ignored. These are a selection of the more common symptoms of kidney failure. It is important to note that there are many others, including cognitive impairments such as memory loss. Notably, a particularly significant symptom in the early stages is the absence of any symptom at all. This makes it essential to consult your primary care provider regularly, seek screening for kidney disease, and ascertain your personal risk factors in order to maintain your health. To support your well-being, I recommend downloading the free PDF, 10 Healthy Habits for a Better You and a Better Life, via the link in the description. It is a checklist of habits that I find personally effective and believe may also benefit you. If you have not done so, please ensure you subscribe and activate notifications. Furthermore, you may follow me on Instagram at Dr. Doctor. Endeavor to live your healthiest, happiest life. I am Dr. Freda.